Sjogren syndrome, named after Dr. Henrik Sjogren, who first identified it, is a common autoimmune disorder, typically happening in women. In Sjogren syndrome, the body's immune cells go rogue and start attacking various exocrine glands, which are glands that pour their secretions into a duct, most commonly the salivary glands and the lacrimal or tear glands. Normally, the cells of the immune system are ready to spot and destroy anything foreign that could cause the body harm. Immune cells called antigen-presenting cells, which include macrophages and dendritic cells, latch onto pathogens and engulf them, literally swallowing them up. Pieces of the pathogen called antigens are then presented on a major histocompatibility complex, class II molecule, or MHC class II molecule, which is like a serving platter for antigens. An antigen-presenting cell then searches for a T cell that can bind to the antigen. Once found, binding to the antigen helps activate this T cell, and then releases pro-inflammatory cytokines, or signaling molecules that recruit more immune cells, ultimately leading to inflammation. The exact cause for Sjogren syndrome is unknown, but it seems to be related to both genetic and environmental factors. Genetic factors include genes which code for specific types of MHC class II molecules, called human leukocyte antigen or HLA genes. Specifically HLA-DRW52, HLA-DQA1, or HLA-DQB1. Environmental factors include an infection of exocrine glands like the salivary and lacrimal glands. Infections can damage the cells of the salivary gland and expose their cell components, including their DNA, RNA, and histones, to circulating immune cells. These cell components get picked up by antigen-presenting cells and presented to T cells. In individuals with Sjogren syndrome, a T cell gets inappropriately activated by these nuclear components and considers them to be foreign nuclear antigens. The T cells then activate B cells, which start producing anti-nuclear antibodies, or ANAs, which are antibodies against the nuclear antigens. Two types of ANAs formed in Sjogren syndrome are anti-SSA and anti-SSB antibodies, which are formed against the ribonucleoproteins SSA and SSB. Then both T cells and antibodies enter the circulation and reach the exocrine glands, where the T cells secrete cytokines to recruit more immune cells and promote inflammation of the exocrine gland tissue. The cytokines also activate fibroblasts in the tissue, which then produce fibrous tissue that replaces the damaged tissue. The end result is a loss of secretory cells in the glands. Sjogren syndrome can be primary and happen alone, and in that situation it's called Sika syndrome. Alternatively, it can be secondary, which is when it happens along with other autoimmune diseases like rheumatoid arthritis. Symptoms of Sjogren syndrome usually present in middle-aged women and are due to dryness of various body surfaces. When the lacrimal gland is involved, it leads to keratoconjunctivitis, which is the inflammation and ulceration of the cornea and conjunctiva. This causes dryness of the eyes, leading to blurring of vision, itching, redness, and burning of the eyes. When the salivary glands are involved, it leads to xerostomia, or dryness of the mouth, as well as difficulty tasting and swallowing, and cracks and fissures in the mouth. In the nose and respiratory passages, it causes ulceration and perforation of the nasal septum, and can lead to crusting and bleeding. When it affects the larynx, it can lead to difficulty speaking. In some people, there might also be dryness of the skin and vagina. There's also swelling of the glands, which can compress nearby structures like nerves and cause pain. Finally, the dryness of epithelial linings can also make infections more likely. Diagnosis of Sjogren syndrome is based on a decrease in exocrine gland secretion. For example, sialometry can be done to measure the saliva flow. Blood tests often show the presence of anti-SSA and anti-SSB antibodies. A confirmatory test is a lip biopsy to examine the minor salivary glands, especially CD4 positive T cells, plasma cells, and macrophages, and thickening of the inner duct wall. Treatment of Sjogren syndrome typically involves medications to suppress the immune response, like corticosteroids, and also medications that increase the exocrine secretions like pilocarpine. Alright, as a quick recap, Sjogren syndrome is caused by autoimmune destruction of the exocrine glands, most commonly the salivary and lacrimal glands, often following an infection. Anti-nuclear antibodies, typically anti-SSA and anti-SSB antibodies, cause destruction of the secretory cells in the exocrine glands, resulting in dry eyes and mouth.
Hi, hope you enjoyed our video on Sjogren syndrome. Thanks for watching. I'd also like to thank Janavi for writing the script, Yifan and Rishi for editing the script, Tana for doing the narration, and Pauline for doing the illustration, and I did the video editing, but I'm not going to thank myself. That would be weird. If you like this video and you want to watch one similar to it, you can go to osmosis.org and check out our Prime service. We have over 100 videos similar to this one. And speaking of 100, you can save $100 and get a free textbook if you sign up for Osmosis Prime for more than a year during our sale right now. But if you don't want to do that, you can just go make a free account, get 2 free weeks, and then decide later what you want to do. Either way, hope to see you again.